Hi, good morning, Shadai.
Good morning.
How are you?
I'm good. How are you, Irene?
I'm doing well.
Good.
You probably know that we're getting ready to celebrate our 60th anniversary here at UF Health, and you've been here quite a while at UF Health. So tell me a little bit about when you came and maybe your career in the time that you've been here.
Okay, well, I started at UF Health in 2001 as a unit clerk on the pediatrics floor. Through that time, I went through school and became a cardiac sonographer, currently in school for my master's degree.
Oh, wow.
And am just growing in my career and my profession.
Good for you.
Thank you.
Good for you. Well, tell me a little bit about how UF helped you to, get your career goals accomplished, because you've really accomplished a lot in a short time.
Well, being in this academic environment, it's just helped me to see, first and foremost, academic excellence, and then it's just helped me as my patient care skills to just give the patient care skills that is needed, necessary, and to always be on the cutting edge of science.
So it sounds like those things inspired you to, continue to grow as in healthcare and kind of help you find a path through where you want to be in the future. Are you stopping with your master's, or are you
going to
continue
stop
to go
with
on?
my master's? But right now, I am going to stop with my master's.
Okay,
Yes.
well, good for you.
Thank
It sounds
you.
like you've had a great career. So tell me a little bit, in the time that you've been here quite a few years, what are the most important changes that you've seen that at UF Health?
Well, we've expanded a great deal. Probably the most important change that I continuously see here at UF is just a progression of knowledge. We never stay stagnant. We're always on the cutting edge of technology, of healthcare, and it just helps us to stay above a lot.
Right, right. And one of the things, because of that, we have to get used to a lot of change, right?
We do.
Right.
Continuous change.
Exactly. Be adaptable and kind of learn to move forward. That's one of the things I enjoy about this organization also. You've been here a long time again, so tell me what are specific changes that you've seen in your career that you value the most?
Well, I work in cardiology currently, so that's a huge change. We just opened up the new heart neurovascular hospital, and I've just seen cardiology grow over the past 10 to 12 years, and we're still growing and we're still evolving. And just the new technology with our cardiac medicine, with our cardiac imaging, it's really increasing and just giving us better tools to help us care for our patients.
Right. I bet you've seen a lot of changes in the medical care that's available, for our patients. All of the new technology.
Lots of new technology.
Yeah, and better outcomes.
Yes.
Better opportunities for patients to get well and better outcomes. So tell me, when you first decided to work at UF Health, what drew you to work here? I mean, why here versus somewhere else?
When I first decided to work here at UF Health, it was just because it was Shands at the University of Florida. Little did I know how we would grow with our partnership with UF, or how expansive our technology and capabilities would become. But that was just the first thing that drew me to UF was just the name was synonymous.
Really, the reputation?
The reputation within the community.
Yep. Right. One thing, one episode, anything that, kind of, when you think about it, warms your heart.
In our cardiology department, just working with all of the heart transplant patients, you're able to see them go from pre-transplant through their journey, through their process, to getting transplant, to then just coming back for checkups. So I'm able to see that on a daily and weekly basis, and being able to follow their healthcare progression. It's just, that does warm my heart daily. Not just with our transplant patients, with our aortic any of our cardiology patients, just to see someone's whole life change.
That's true.
And be able to follow that care is pretty amazing.
Right, because you have long-term patients, so you see them when they're really sick, and then as
they get better.
Right.
Yeah, you see them during the process and then after the process.
Right.
And so,
I bet you get a lot of hugs.
I do.
For helping them, I bet you do.